Welcome to Conversations at Colors. My name is Debria Dunstan, and I will be your moderator today. We have our medically experienced panelists to discuss monkeypox, also known as MPOX. With us today, we have Dr. Aaron Rickerman, a physician scientist specializing in infectious diseases and an instructor of medicine at the University of Pennsylvania. His research focuses on the relationship between poverty, food security, individual, and population outcomes for infectious diseases, and the use of social safety nets to improve these outcomes. He is passionate about improving the lives of people living with HIV. We also have Dr. Florence Montplaisir, Assistant Professor in the Division of Infectious Diseases, Vice Chief for Diversity, Equity, and Inclusion in Infectious Diseases, and Senior Fellow of the Leonard Davis Institute of Health Economics at the University of Pennsylvania. Her clinical research focuses on improving retention and care and viral suppression of pregnant and postpartum women living with HIV, and on decreasing racial disparities in HIV prevalence among U.S. populations. In addition to engaging in research, she provides clinical care, teaches, and mentors early career investigators interested in work at the intersection of HIV, HIV prevention, women's health, and implementation science research. We also have Dr. John B. Germont. He received his PhD in psychology from Harvard University. He is now the Kenneth B. Clark Professor of Communication and Psychiatry at the Annenberg School for Communications and the Perman School of Medicine at the University of Pennsylvania. Dr. Germont is internationally recognized for his National Institutes of Health-funded behavior intervention research, having received more than $64 million in funding as a principal investigator to develop effective health behavior change interventions. Explain why interventions work better in some populations than others, all aimed at reducing racial health disparities. So guys, welcome to the conversation today.
Thanks for having us.
So let's jump right into it. What is monkeypox, also known as MPOX?
So monkeypox is a virus that causes an infectious disease. And the reason it's called monkeypox is because it was a virus that was first identified in some laboratory monkeys, actually, but it doesn't really well describe what it is or how it acts in the wild. It's a virus that we discovered a long time ago, about 50 years ago. And we think that it mostly resides in rodents and small forest animals, but it does make its way into humans as well. So when you hear the word monkeypox, that pox kind of signifies to you, it tells you that one of the main manifestations of this virus is a pox, like a chicken pox or other poxes you may have heard, but the pox is like a rash, right? It's a small blister that may appear on the skin. And so that tells you that that's one of the most common symptoms of it. But because monkeypox is not really a very accurate description of what the virus is, and because there's certain stigma that can be associated with referring to the virus as monkeypox, that's why we've now tried to move towards calling it MPOX rather than monkeypox. So, like I said, this virus has been around for a long time, but it's only relatively recently that in our area, in the United States, it's become a real major concern as the virus sometime last year started making its way into our area. And when it did make its way into Philadelphia, what we've seen is that it manifests with certain symptoms. Again, there's that rash with the pox, and that typically will show up in places like the genitals, around the penis or the vagina, also around the anal area, but can also show up, on the arms. It can show up on the face, in the mouth, and so that's a very common symptom. But people also get other symptoms that are seen with viruses, things like fevers or just feeling kind of run down and not well. So the other thing that's important to know about MPOX is that at least in this sort of recent outbreak that we've had over the last year or two, the primary way that we've seen it pass between people is through close contact. And so it's not contact like us in this room where we're sitting, a couple feet away. It's, close skin to skin contact. And most of that transmission that we've seen is through sexual contact, which of course, is a very important kind of close contact. And so, in what we've seen over the last year or two, that sexual contact has been a really important way that we've seen this virus pass from person to person.
Wow. Wow. Is there anything that makes people at risk for monkeypox? And how long does it usually take for them to feel better?
Yeah, so what I would say is, in addition to what Erin mentioned, is to think of monkeypox in terms of the way it manifests as the common ways in which viruses manifest, right? So people can feel very lousy, have a fever, muscle aches, in addition to having the rash. What's also important to know is how well people are at baseline will also determine how well they recover from the illness, right? So, and we saw this actually with COVID-19 as well. So people who are older, who are sicker, have a lot of comorbid conditions. By that, I mean cardiovascular disease, kidney damage, liver disease, or immune deficiencies like HIV or cancer can have more severe manifestations of the illness. So it's very important for people to know that it's something that they have to take seriously if they do have symptoms, and particularly if they fall into the category of having other comorbid conditions, that they don't delay to seeking testing and to seek care.
Okay.
Yeah, and I think the other point is that in terms of how long people are feeling sick when they have it, it does vary. I mean, I think a lot of the patients that we've seen who don't have some of these other, health conditions that put them at risk for more severe illness, people are generally feeling better within 2-ish weeks or so. It can be a little faster, it can be a little longer, but this. A lot of the patients that we've seen have been surprised, I think, at how long really that takes. I mean, 2 weeks is actually a pretty long time to be feeling bad with this. So it can lead people to feel sick for a little while.
And I thought that monkeypox went away or MPOX went away. How seriously should we take this? And do you think we really should worry about it at this point?
Yeah, I mean, I'm really worried about it, I'll tell you. I think, last summer when it first arrived here, we saw quite a lot of cases all at the same time. And I think that what we were seeing then was a combination of, well, this is a new infection in our area, at least, among a lot of people who hadn't been exposed to it before. And so there was that period of time where we were still trying to figure things out. But as we saw the numbers go down, the numbers didn't go away. We've seen throughout the winter continued cases of MPOX, and especially in recent weeks, we've seen those numbers start to go up. So I think we, are hopeful that it doesn't, return to the level we did see last summer. But I think the worry among a lot of the healthcare providers here in Philadelphia and around the country is that we're going to see those numbers, go up as the summer months come.
Wow.
Yeah.
And I do think that it's not because it's not in the headlines and we're not talking about it every day that it's gone, right? And we've seen a few cases in Philadelphia in the past couple of months. And so what this tells us is that there is community transmission. And if people are not thinking about it, and not hearing about it, they might not seek testing and care. And so, then there's underreporting of cases. And so I think it's important for people to be aware of the symptoms, the risk, like how people can actually acquire it. And if they suspect that they either had sex or have been in close contact with someone who had monkeypox or MPOX, to actually go and seek care.
And so that leads to my next question. So if you're exposed, right, what are your options? Like, what should you do if you do start to have that breakout or you get that fever and it's not quite a flu, but you have these other symptoms that are similar to MPOX?
Yeah, so actually, if someone is exposed and doesn't have symptoms yet, I think the best thing to do is to seek vaccination. We know that vaccination is safe, and if people start having symptoms, then it makes more sense to go seek testing, and there are available treatments to treat MPOX. But I would really encourage everyone to think about vaccination, not only if there's been a possible exposure through sex or skin-to-skin contact, but the CDC talks about very specific criteria for vaccination, and if people have multiple sexual partners, if they had sex with someone with known monkeypox or suspected monkeypox, those individuals should get vaccinated.
Yeah, I think you're really bringing up a good point, and something I see, when you're talking to people about vaccines, is that not only you think about vaccines as trying to prevent something that you haven't been exposed to yet, but they can actually also be useful in scenarios where you have been exposed, but you're not yet feeling sick from it. So I guess the most important take-home message I would say is that there are options to help prevent getting MPOX at all, and also potentially, the vaccine may also make it less severe if you were to get it, even after you've been exposed. I think if you're in a situation where, you actually have symptoms and you may have had an exposure, it's really important to think about contacting your doctor or your healthcare provider, or to come to one of the health centers where they may be able to do testing, because there are also some treatment options available as well for people who have actually become sick with the virus. The primary medications that we've been using and we've used last summer there's an antiviral. So this is a medication that fights against a virus, and this is a medication that's called tecovirimat, and this is not a brand new medication. It was actually developed to fight against a related virus called smallpox, which isn't around anymore, but is closely related to MPOX. And so this is a medication that we know is safe in people. It's been tested in trials to be safe in people, and we have good reason to believe that it is probably effective for MPOX, although some of that data is still new as we're now just using in this area. But the take-home message, I think, is that this is a medication that may be a good option for people who, especially in those higher risk categories, to help keep the infection from being as severe, and it's certainly a very safe medication that's not something brand new that's been just developed in the last year.
Can you still get MPOX after being vaccinated or doing one of those treatments?
Yeah, that's a really good question. So, if you think about a lot of different infections that people may run into, and COVID's a really good example that I think is at the top of everyone's mind. When COVID first came out, we weren't sure. Once you've seen the virus, once you've had the infection or you've had the vaccine, and your body has built up this defense, is that enough to keep you from getting infected again or not? And it turns out with COVID, there's still the risk of getting the infection down the line, even if the risk is lower. And we think that's probably the case with MPOX as well, where if you've had the vaccine, it seems like your risk of infection in the future is decreased by about 80% or so, which that's a pretty substantial degree of protection, but it's not bulletproof, right? And we think that similar to a vaccine, if you get MPOX, if you get the infection, let's say you had it last year, we don't have the exact numbers on this yet, but we have probably a good reason to suspect it's probably around the same. We have seen now reinfections in this country in a small number of people. And so, I would urge people who've had the vaccine or have had the infection before to think that, that they do have a pretty good amount of protection now, but it's not complete and 100% infection or protection, I should say.
And so if someone is interested in getting the vaccine, what should they know? Does it cost money? What do you do if you're not insured, you're uninsured? And who's eligible to receive the vaccine at this time?
Yeah, I think we've learned a lot from the COVID pandemic when thinking about equitable access to very important resources. And I think the health department in general in our healthcare system has done a pretty good job at understanding that the cost-related barriers is an unacceptable barrier. And so the vaccine is administered, it's available for free. In some cases, for example, at specific pharmacies, they do charge an administration fee, but the vaccine itself is free of charge. And so I'm really happy to see that this financial barrier was removed.
Yeah, and I would point people to the health department. The Philadelphia Health Department has a very good website that kind of outlines where the different locations that you can get the vaccine in the city are, and there's a number of different kinds of places you can go to get it. And to Florence's point, despite kind of the lessons that we have learned or not learned from the COVID-19 pandemic, when you look at the vaccination data across the country, there's still really very substantial, particularly racial disparities in terms of who's accessing the vaccine. So there's still a lot of work to be done in that area.
Wow.
But can you get the vaccine for free at the health departments, at the public health departments?
Yeah, so I think at the health centers, where which are administered by the health department, you can get it for free there. And there are also some community sites, I think, that you can also get free vaccinations. So that website really from the health department has a really good, comprehensive list of all the locations that have the vaccine. And it may be, and so that may also change over time. As the summer progresses, particularly if we're seeing more cases, I would expect that more providers would be given access as well. So it may be good to kind of check back there to see the most updated data on where the vaccine can get.
And how is the vaccine administered? Is it one shot? Do you get 3, 2? Like, what does that look like?
So again, I think people have probably the COVID vaccine fresh in their mind, or their other vaccines that they've had, and you think about the basic principle of what a vaccine's trying to do. It's trying to show your body a little piece of this infection so that it can recognize it in the future. The first time your body sees that, it's not very good at building its defense. But if it sees it again, then it really kind of refines that defense. And so that, if you think about the basic principle of why oftentimes vaccines are multiple doses. And so just like that, with the MPOX vaccine, we recommend 2 doses. And so you get one, and then you get another one 4 weeks later. And so it's not like one dose doesn't give you any vaccine protection. We see that it does give some, but that second dose really refines the protection and really gives an added boost to what people are going to be seeing. So, for people who've had one dose of the vaccine last year and then, may have kind of had other things come up and didn't come back, it's not too late to get that second dose and to get some additional protection from that.
Awesome. That's great. And I know we have been talking about how this is across the country, but thinking about Philadelphia, where we are, how has the city talked about MPOX and spread awareness about it at this time, based off of the research and the information that you all have?
Yeah, so as healthcare workers, the city actually has done a very good job at communicating with us when the cases are going up, because we want that increased awareness, right, within the medical community, so that when people are presenting with a rash or a sexual transmitted infection, we can think about testing and think about providing the vaccine. And that information is usually provided in a newsletter or broadcasted to us, and so that's really how we as healthcare workers have access to the information. And obviously, collaborating closely with the health department is very important, particularly when thinking of the supply of vaccines, which last year was. It came with challenges. And so it's very important to sort of, again, anticipate when the numbers are being high, just to make sure that we have the supply needed to be able to respond to the need.
Yeah.
And just thinking about how we started our conversation around language and the use of, for example, monkeypox, which can be stigmatizing, right? And using MPOX. I actually would like to ask Dr. Jamaat, since you have expertise in particularly stigma, do you think that using non-stigmatizing language is important here?
Yeah, it would be a big help to people. The idea of monkeypox is, inherently stigmatizing. I'm also thinking that when people see symptoms, these rashes, in their genital area, they are probably hoping that it'll just go away by itself. And I think that probably is going to contribute to some delay in seeking treatment. So that's another way that the stigma can affect them. And if they're already a member of a stigmatized group, just adding this as another layer, is definitely going to be a problem in terms of seeking healthcare.
And just can I follow up on that? What do you think are ways that we can kind of fight against that stigma, from the outside, or what are important ways that organizations and groups and things can fight against that?
The best way is through education. Educate the public broadly, because you have to decrease stigma in the community. Before even the self-stigmatization of the individual, it's really the community that's pressing on the individual with the stigma.
So it's kind of like this understanding that this virus is not, does not indicate something about a particular person. I mean, this is just something among human beings that can be passed from anyone who's in close contact, and
anyone can get it. It's not linked to specific groups. Any of us is vulnerable to it. It's an infectious disease.
Yeah.
Yeah.
And I love the thought of education. And so how can we advocate for more awareness to younger generations? Because we know that accessibility to education, or having these honest conversations about sex and sexually transmitted diseases is not something that's happening in many households. And so children are out and figuring things out on their own. So how can we get there and maybe just have more awareness in communities about MPOX so that they have access to that information?
Well, traditionally, the way to do it is through the schools, through sex education, health education in the schools. You can also take, I think, a very effective community-based approach where you reach out to parents and give parents the education on this so that they can educate their kids, and also so the parents won't feel the stigma themselves.
Yeah, I mean, and from a healthcare provider perspective, I think I'm always trying to, when I'm meeting patients, trying to really normalize the idea of sexual health, like how important sexual health is in general, particularly for, younger people who may not have other health issues that may be their primary issue that, we really need to follow up on. And part of that is for them, and part of that is like normalizing the discussion around it, and normalizing, trying to normalize their discussion with their peers. Because a lot of these discussions are happening, not between doctors and patients, or from parents to children, but between peers who are interacting with each other. And so as much as we can, just normalizing the conversation around what MPOX is, that the options to prevent it, to treat it, I think the more that can make its way out into the community.
Definitely.
Yeah, and when I think of stigma, I think there are sort of two levels that we have to consider. First is, as John mentioned, the individual, having to sort of place a value judgment to their symptoms and what it means, to have MPOX. But also on the healthcare provider perspective, right? Because if we have a patient who's overcoming their internal stigma to come to care, right? It's unfair to have them come in and also stigmatize them, making them feel that they've done something wrong or that they engage in risky behavior. And so I think the need for education is honestly at both levels, so that we can, one, empower communities and parents and young kids and even older individuals to recognize that this is just a medical issue that needs to be treated or prevented. And then healthcare providers to really, like Erin said, approach people in a non-judgmental way and provide that safety, right? So that people can come and just be honest about, where they are and what they need.
Yeah. And Dr. Florence, I love how you talked about prevention and protection. So anybody listening today, and they may feel like, oh, now MPOX is there and it's out and I have to be more aware. What can they do to protect themselves starting today, going out into the world?
What I would do is honestly start by going through the CDC website. The CDC website lays very clearly reasons why people need to be receiving the vaccine. If you fall in any of those criteria, I would say go to the health department website and look at the community centers and the places where you can actually seek vaccination. Vaccination is safe, it's effective. We know that people who are vaccinated tend to have or are either protected from having symptoms, or if they have symptoms, they have very mild symptoms. And so I would say, the summer is coming. We're predicting another surge. Now is the time to really think about this and go to and go and get vaccinated.
Yeah, and the other way that people will use to try to prevent other STDs, STIs would be things like condoms. And just to highlight that, we don't know for sure how protective condoms are to prevent transmission, especially if you have, blisters that are not directly covered by the condom. But we still believe that there is going to be some protection provided by that. So, for people that haven't had the vaccine, that's another good strategy to use to try to reduce their risk as well.
I know you all are also interested in learning more information about MPOX through the community. So can you tell me about how people can get in contact with you, or, just to share their experience with you guys too?
We're conducting interviews with people from the community to get a better understanding of how the community perceives MPOX and the vaccination and testing and so on. And so we have a QR code that they can click on, and then they would be invited to participate into a Zoom interview. And we would ask them questions to assess their beliefs about MPOX. What are they concerned about? What do they see as being, the benefits or the negative things about, getting the vaccine, and how others in the community, how they perceive that others in the community view the vaccine, as well as MPOX and things along those lines.
And the reason why we are interested in getting this information is because when we think about building interventions, right, we want to incorporate the community voices and understand how to respond to people's concerns. And we can't do this without you. So we definitely need your perspective. The interview itself doesn't take very long. And the data that we get is very important to help us come up with interventions that will support communities to fight against MPOX.
So you all shared some really great information, and I know we talked a lot. Is there anything else you would like to share that you feel that people should know about MPOX, that they can take with them, put it in their back pocket, and that they can remember, like, okay, this is MPOX, this is what I need to know, these are my options? What would you like to share?
Well, I would just highlight some of the key points, which is that this is a preventable illness with vaccination, that the vaccine is safe, that it is effective, that it requires 2 doses to be as protective as it can, and it's a really great option that's out there and should be available. That if someone is exposed, they have options even if they're not yet having symptoms to still get the vaccine. that if people are having symptoms, I would just strongly encourage people to try to find a provider to help get testing, because there are options. People do not have to suffer alone through this, and we're really trying to do everything we can to reduce some of that stigma that exists. Both individual and from healthcare providers. So, just don't suffer alone with it would be my biggest piece of advice.
Wonderful.
And what I would say is for people to be empowered, they don't need to be passive. They can actually take action and protect themselves through vaccination. And so that's what I would say is the vaccination is the best way to protect yourself. Again, the vaccines are available, not widely. There are very specific places where you need to go to get them. I think the health department has done a good job removing at least a lot of barriers to access. And so I would please talk to your primary care provider, or even if you don't have a primary care provider, consider going to one of the community-based sites or the community health centers where the care is available.
I would agree with what's been said. The one thing I would add is this is a disease that's affecting the community. And I think people in the community should also, not just worry about it as an individual, but try to destigmatize it. If you have it, seek care. If you suspect that someone else does, then encourage them to seek care and try to prevent them from being stigmatized, and just being willing to do something for the community, as a whole, because it not only affects the individual, it affects the whole community.
Yeah, those are conversations I think are really important to have, just being able to, normalize it, even if, you haven't had it, you don't know anybody with it, just having conversations with the people around you and kind of normalizing that and the understanding about it. I mean, that's how communities can work together to protect themselves from these things.
Absolutely. And if anyone out there, if you would like more information on MPOX, please visit the Philadelphia Public Health Department website or the CDC website. And so I would like to say thank you to Dr. Aaron,
Thank you very
Dr.
much.
Florence, and Dr. John for this lovely conversation on MPOX so that we can destigmatize the ideas around it and to get people out there vaccinated and the proper treatment.
Thanks for having us.
Thank you for having us.